I guess if you guys have questions, let me know. Are we ready? Okay. Hello, everyone. Welcome. Thank you very much for joining us. It's good to be with you. It's been a while since we've been together in this format. As you know, everybody's been really busy. I know you all have, and we certainly have as well. We really look forward to the time when we can get back out and visit with people around the state regularly like we were doing before. You know, we had a slight reprieve, we thought, in the month of June. We actually managed to get out and restart our visits for a couple of places. And then suddenly the Delta variant hit, and we've been holed up here in Montgomery ever since. And so we do think maybe we're seeing a little bit of improvement yet. It's not clear if that's going to be a long-lasting thing or how long we're going to be doing with that. But I know all of us are really very much looking forward to getting back to normal someday, whatever normal looks like. We have hit a few milestones related to COVID recently, some of them good, some of them not so good. We're now, unfortunately, we've now had more than 14,000 deaths, in fact, approaching 15,000 deaths in our state. That represents about 1 out of every 350 Alabamians who've died from COVID since this began in March of 2020. It's just hard to believe. And you know, you've heard it said before, 1 death is a tragedy and 1 million deaths is a statistic. So I don't want you to think about 14,000 deaths as a statistic. These are 14,000 people that we know. These are people in our family. They're our friends, our loved ones, the people we work with, people we go to church with, the people that we watch football with. These are our neighbors and our friends and family, and the people that we in public health are dedicated to serving and trying to help and trying to protect. And unfortunately, this has been the worst pandemic in the history of our state. Our country has lost more people from COVID than we lost during the Spanish flu epidemic in 1918 and 1919, which was the worst epidemic in our country's history. In fact, this past year, we have had more deaths in our state than births in our state, and that has never happened before in the history of our state. Our state has actually shrunk because we have more people die than we had being born in our state. And going back more than 120 years and looking at the numbers that we collect here at Public Health, we have never had a year like that. That's just a terrible situation that we've had to endure. And unfortunately, that's true for the entire country. In Alabama and in the United States, we have now had more deaths in 2021 from COVID than we had even in 2020. The first deaths in the U.S. started in January of 2020. The first death in Alabama was in late February of 2020 before we even realized it. But now we've had more deaths in this barely 10-month period than we had in all of last year already. So those are some discouraging numbers. We are encouraged by the fact that people are starting to get vaccinated finally a little bit. We passed the 2 million mark this week in terms of numbers of Alabamians who are fully vaccinated. We would like to be doing a lot better than that. We still trail a lot of the country in that, but that's still quite an improvement, and that's due to the work of a whole lot of people at ADPH and other folks as well. Many of you have been working day and night on those projects since we started doing vaccinations back in December, and it is really paying off. We have a long ways to go. We're ahead of about 8 states in the country in terms of people who've gotten at least 1 shot. We're ahead of about 3 states as of this week in terms of people who are fully vaccinated. So we have a lot of room to go, a long way to go, but we are making some improvement, and I do want to thank you for that. COVID continues to be very divisive. It's a very challenging and difficult time for our country as a whole, whether we're talking about COVID or anything else. I know many of you who are working on the front lines are putting up with some really difficult situations. I know many times you don't feel appreciated. I know many times people in public health are actually coming under attack just for doing the right thing, just for trying to take care of people, just for trying to give people the expertise, your expertise and your training and your knowledge. Sometimes people just don't take that well. I know that eventually we're going to get through this. I want you to know in the meantime that I appreciate you very much. I wish everyone in the state of Alabama appreciated our ADPH workers as much as I do. I really do appreciate you, and just want you to know that what you're doing is not going unnoticed. It is terrific work. It's really protecting our families and our friends and our loved ones with everything that you do every day. And so please just know how much we appreciate it and how grateful we are for that. We have some questions about what's going to happen in the future. What's the situation going to look like with public health as we move on? I think our country in general realizes that we're going to be dealing with COVID for a long time. I think we're going to have to find a way to merge this into just our normal activities so that it's not a special emergency response, but it's part of what we do every day. That's really, a tall order, and none of us really know exactly what that's going to look like. I can tell you that as of this week, 100% of our county health departments are offering vaccinations 5 days a week to anyone, and that's a tremendous accomplishment. I'm so proud of everyone who's worked on making that possible. We are the place to come to if people need to be vaccinated. The single most important way that we can stop the pandemic is to get people vaccinated, and so I'm very, very proud to say that ADPH is now offering that every single day in every single county health department. That's a remarkable achievement. We're almost at that same level in terms of offering testing as well. We're not at quite 100% of the health departments every single day, but we're getting very close to that as well. And I do believe that testing and vaccination, those programs are going to be things that we're going to be doing for a long time, ongoing. It's still not clear what's going to happen with in terms of whether people are required to be vaccinated or not. The state of Alabama is certainly not requiring anybody to be vaccinated at this point, although the federal government is looking at ways to try to do that. There certainly may well be employers, private employers in the state that are going to have vaccine mandates for people. It's not clear right now what public health needs to do with regard to our frontline workers. But I do want to say something, and I want you to hear what I'm saying very clearly. You absolutely need to be vaccinated. We are not requiring at this point ADPH employees to be vaccinated, but that doesn't matter. You need to be vaccinated. I don't know of a good reason that anyone who works for ADPH should not be vaccinated. You may have, a unique medical situation, and your doctor may tell you otherwise, and we understand that those situations do exist very rarely. But everyone who works for this organization needs to be vaccinated against COVID-19. It's the right thing to do. It's the right example. It gives us credibility when we're trying to tell other people in the community that they need to be vaccinated as well. And it is still the single most important way and effective way for us to stop the pandemic. We understand that some people have been infected with COVID before. You may have some natural immunity on board, but that immunity is much stronger if you are vaccinated. We know that for a fact. We know that there are some side effects that can occur with vaccinations, but those side effects are extraordinarily rare, and virtually all those side effects occur many, many times more often with people who get COVID than with people who simply get vaccination. If you get COVID today, odds are about 1 out of 50 times you're going to die. About 1 out of 10 times you're going to be in the hospital. Virtually all the people in our hospital now who are dying from COVID are unvaccinated people. Around 85% of those who are occupying a hospital bed are those people who are unvaccinated. There's no good reason not to do it, and we don't want to harangue people and beat people up or try to make people feel guilty. We just need you to understand that the science is settled on this. We have a vaccine now that's fully approved by the FDA. It has more safety information than we have ever had in any vaccine in the history of our country. More than 300 million people have taken this vaccine before it was even fully approved, and now we know what the safety profile is. So if you're on the fence about that, I can certainly understand it. Many people have very legitimate questions about whether the vaccine's right for you, or right for your family, or right for your kids, as we will begin to talk more about vaccinating kids soon. I want to say to anybody who's listening, please call me if you have a question about whether you ought to be vaccinated. I'm happy to take that call. I can do it privately and do it anonymously. I think I can speak on behalf of our other physicians who work for public health as well, like Dr. McIntyre and Dr. Taylor and Dr. Landers and Dr. Stubblefield. We all would be very happy to talk to you about whether you need to be vaccinated. Ultimately, you need to talk to your own doctor and make your own decision. but we're here to answer those questions for you, and I hope you'll feel free to reach out to us if you can. Those were all the preliminary things that I wanted to say today. We had put out notice that we wanted to answer questions if we could do that. We did get a couple of questions that came in, and so I'm going to start by answering those, and if we get any others before we finish, then I'll certainly be glad to answer those as well. Received one letter today from someone who wanted to know if ADPH employees would be able to receive hazard pay because of working through the pandemic. I would have to tell you, unfortunately, that's not an option for us. There were a couple of state agencies that very briefly got hazard pay about a year ago when the governor's original state of emergency was in place. It was possible at that time, under the governor's state of emergency, there were a couple of situations, like in the Department of Mental Health, for example, where workers were simply unable to wear masks when working with their clients. And some of those people who worked in those hospitals received hazard pay for a short time. There were some people working with youth services who were in situations where they were literally being spat upon by their clients, and some of those people received hazard pay for a brief time. But those are the only state agencies, to my knowledge, that were able to do that. I would say we talked a lot about it, whether it was something that we could do. It's very difficult to find a workable solution. Clearly, it wouldn't be appropriate to give every single person in the agency hazard pay because not everyone has the same risk. Even trying to do that by job classification can be real challenging. You know, just because someone is, for example, a nurse, let's say, they certainly may not all have the same risk of exposure, and it becomes very difficult for people, for us to try to determine the individual risk of people. So really, most importantly now, it's not an option for us because that original state of emergency is no longer in place. That we do have a state of emergency in place for hospitals, but we don't have one that would allow state agencies to do that. So that's not to say that we don't appreciate very much what our people do. The people who are taking care of the public really are on the front lines. I'm sincerely appreciative and grateful for what you do. I wish everyone could get paid more. Everyone deserves to make more, but that's not an option that we have right now. I had a second question that's along similar lines, and this has to do with reclassification of ASA staff and salary scales, and whether it was possible for them to have raises as well. As you know, there were some salary surveys done recently by state personnel, and there has been an increase in the salary scale for nursing staff and for HSA staff. I would say we absolutely want to be able to do that for all our employees. We were grateful that the governor did give all state employees a cost of living adjustment this year. We certainly wish we could raise the pay scale for everyone, but it's not as simple as us deciding to do that. That is actually a process that goes through state personnel. State personnel will do a salary survey of others in the industry and other state governments to see what those payments are, see what those salaries are. It has a lot to do with how difficult it is for them to fill their registers, how many people are actually applying for jobs, and is it becoming harder to recruit for a particular classification. So I want you to know that we'll continue to look for that, look at that. If we have any opportunity to try to do that, we certainly would like to do that. Again, we appreciate everyone who works for public health. All of you deserve to make more than you do. You are all people who have dedicated yourself to state service to take care of Alabamians, and I don't think any of you make what you deserve to make. You certainly deserve to make more. So those were the only two questions that we had submitted this time. Any other questions or anything from anyone here? All right. We'll wrap up at this time. We don't have any other additional questions, but again, please know that I appreciate you very much. Thanks to everyone for everything that you're doing. Please continue to take care of yourself. Remember to take care of your own mental health. Remember to take care of your own physical health. It's been a really difficult time, and we want everyone to understand the importance of taking care of yourself as well. Eventually, we're all going to get through this together, and we'll hopefully sooner rather than later. Thank you very much.